Welcome to our presentation on turn rotations, presented by Lauren Beaver, Jennifer Bowers, Keely Collins, Gabrielle Stack, Ann LaPerry, Kelly Sitter, and Logan Summers.
Our PICO question. Our population are the patients at risk for pressure ulcers. Our intervention is to initiate every 2-hour turn teams by the entire nursing staff. Our comparison is the assigned nurse and nursing assistant turn their own patients throughout the shift. And the outcome that we hope to achieve is a decreased skin breakdown and decreased occurrence of hospital-acquired pressure injuries.
The first article that we reviewed, Reducing Pressure Injury Incident Using a Turn Team Assignment, is a descriptive correlational study. The study took place in a surgical ICU and included turning patients every 2 hours using a unit-designated improvement tool. This tool included the use of queuing, concurrent turning of patients on the floor, independent turning with cues from staff support, and possible barriers to turning and repositioning. Using this tool, pressure injuries declined from 24.9% to 16.8% over the data collection period. They found a strong correlation between verbal cueing and turning of the patient. Additionally, the study concluded that using turn team assignments and current floor staff increased the frequency that patients were being repositioned and decreased the pressure injury prevalence rates.
In a 2004 study by Dr. Bradley Hobbs, education provided to turn teams comprised of 2 nursing assistants focused on a more holistic approach, narrowing in on overall benefits. This led to a decrease in referrals to wound care, decreased length of stay, decreased musculoskeletal injuries among staff, and lower infection rates, specifically C. diff and pneumonia. In this study, it's important to note that while it did require delegation of regular staff to turn teams, it did not require hiring of additional staff.
Reducing hospital-acquired pressure injuries by cultivating team ownership of prevention with budget-neutral turn teams. Staff assigned to turn patients at 2-hour intervals. Peers switch off at the 2-hour interval. Minimal cost involved while using whiteboards to communicate assignments, turn clocks, educational time. This causing a decrease of hospital-acquired pressure injuries by 75%.
In conclusion, our final recommendations for turn rotations include that turn assignments should be included in the standard huddle assignment and should indicate who is responsible each time. Queuing staff should occur when turns need to be done, such as with an alarm or reminder over Volt. And lastly, we should add a column to the hourly rounding sheets to help indicate that a patient has been turned, or instead, to have a centralized whiteboard at the nurse's station, which would include a list of turn assignments and a space for staff to initial when completed. We will be happy to answer any questions you may have for us.
In an effort to foster dialogue about this really important topic, we decided to come up with a few sample questions. First, what is important about this, and why should we care? Promoting skin integrity is a significant part of nursing, both here at St. Luke's and nationally. Unfortunately, it's something the system could improve upon. Per the St. Luke's May Shared Governance Council, HAPIes, also known as hospital-acquired pressure injuries, are on the rise at SLH. We believe that the information provided in this presentation and implementation of it will lead to better patient outcomes and a reduction of pressure ulcers. Why can't each nurse just be responsible for turning his or her own patients? Nursing is a team effort. In regards to patient assignments, it would lessen the burden on a single nurse or nurse assistant to turn his or her own patient or patients. It would promote nursing staff getting to know multiple patients on the unit rather than just their own. Finally, it would lessen workplace-associated injuries among nursing staff. The third and final question is, what positive outcomes will this have? The positive outcomes are in the previous answers, but will also be shown through the decreased incidence of HAPIes within our health system, which will ultimately improve patients' health and clinical experience, which is the number one goal.
And here are the references we used for our research. Thank you for watching.